Well, hello, everyone, and welcome to Health Chats Among Friends. My name is Deidre Kindred. I'm a nurse advocate, educator, and navigator. And tonight on Health Chats Among Friends, I have my good friend, Dr. Brad, and he's going to be talking to us about what he does, who he is, and his wonderful company and service, Breathe, Breath Space. Breath Space.
Yes. Hi, how are you doing today?
I am great. I'm great. I almost messed that up.
That's okay.
So
Yes.
tell the audience a little bit about yourself, and then we're going to talk about your company, BreathSPACE.
Great, thank you. So I'm a naturopathic physician. I'm a naturopathic physician here in Seattle, lovely Seattle, Washington. It's a beautiful sunny day. So if you're hearing this whenever, we do have sun in Seattle. So as a naturopathic physician, I'm a licensed primary care provider in the state of Washington. So I can be your primary care provider, but that's not my work. My focus in my work is really working with people and teaching them how to be resilient. I work with the biopsychosocial model. I work with people about empowering them. My original work was in HIV care. When I graduated over 20 years ago, I worked with HIV care as a primary care naturopathic physician specializing in HIV care. Then my practice evolved because while I was helping manage medications and supplements, the real crux of the conversation always was, how are you living with this diagnosis? How are you navigating the healthcare system? Mm-hmm. Many of the people with whom I worked were tapped out with insurance, couldn't afford basic care. So that was the crux of it. It was really, how are you living with this diagnosis? How are you living in the world? And from there, I started working with colleagues in oncology, and I kind of developed into a behavioral medicine specialist. And I got trained in biofeedback. I did an end of life study where I did hospice meditations. I've done over 500 bedside hospice meditations. And that study was looking at the quality of death. And so all of this is the same thing, even though the diagnoses and conditions can change. It's about helping people explore, how are they orienting to their diagnosis? How are they navigating? And not simply collapsing all the parameters and saying, well, you just have to think positively, because I find that very damaging to people. Also incorporating, are you safe in the world? Economically, politically, do you have access to care? Because a lot of people on social media and in healthcare just say, think positively, you can manifest this. And it's like, no, we're talking about, like, we have to incorporate reality. So in my work, I see people with all kinds of diagnoses. I still see a fair amount of PTSD. I work with a lot of PTSD. But the people with whom I'm working, we're saying, okay, how do you want to show up in the world given the way the world is right now? And then we explore those options and those practices. And I really am heavily influenced on mind-body medicine practices. I'll use biofeedback so people can see that when I think this way, look what happens to my heart and my skin conducting. So they can see that. But it's really about creating those skills to help be more resilient. And validate. It's not just you. It's not all in your head. It's not just think positively. Let's look at what else is going on in the world.
Right. Oh my goodness, this is huge because, with our recent pandemic, that I equate that nearly to the HIV crisis, because people get ostracized, there's labeling of people, there is so many dynamics that you get the vaccine, that you not get the vaccine, and so do you get a lot of those clients as well? Working through that?
Yeah, the pandemic hasn't not touched anyone, has not touched too many negatives, but it's touched everyone. Whether you're pro-vaccine or against vaccine, masking, it's like, but how do I navigate this? And we know that it disproportionately affects people of certain races and genders and and political, and so you can't not take that into account in healthcare. When I graduated from Bastyr University, which is here in Seattle, Dr. Bastyr died the year I graduated, and he did guest lecture in our classes a few times. But one of the things I remember him saying is healthcare is a political statement. Medicine is a political issue. And so we can't negate that. We can't ignore it. Well, we can try. People try. So yes, the pandemic's been even just with not being in person with people.
Right. The isolation. So explain to me typically how, without giving away your secrets, how do you service a client? How do they go about reaching out to you?
Yeah.
Do you do it virtually? Do you do it in person?
So in the middle of the first year of the pandemic, of course, in March, I closed my office. I was sharing an office space, and my lease was up at the end of that year, 2020. And I was like, I've been doing it all virtually. And what's interesting, prior to the pandemic, about a third of the patients I've worked with, clients, patients, were virtual. I'd see people all over the country. And so I did that, but it was different. But then now the pandemic hit and I closed my office and I was doing it virtually. I was actually busier virtually than I was when I was seeing people in person. So now I'm all virtual. I've played with that. I played with, do I want to go back? Because there's some people, but I'm finding it hasn't hindered my work and in fact has helped my work.
Absolutely. I was going to say that.
So I'm all virtual. People contact me through my website, the BreathSPACE.com. But people can log on, they can schedule appointments that way, or they can email me. And I'm seeing people virtually and it works really well. I still can do some of the other things. Like I was doing biofeedback, which is where you connect with equipment to monitor your own physiology, specifically heart rate. That's what a lot of people are doing, something called heart rate variability. But there's a lot of inexpensive options now. And the benefit of this, when people saw me in person, I had the equipment and then they would just practice something on their own. But now they can get apps for their phone and they can get wearables and they can monitor and track all this themselves. And what I have people do when they work with me, if they're interested in that avenue, is they share their screen through their phone or their app, and we can still do that work. So
awesome.
It's one of the things I think is wonderful about technology.
Yeah.
And with the pandemic, just going back to that, with the isolation, I've had patients who still are getting COVID, and guess what? They can get COVID and still see me, and they can cough, and we're not worried about it.
Yeah, right. That's amazing because, COVID basically helped you expand your reach,
Yes.
helping more people and that's another thing about, some businesses like mine is partial, mostly, I say 85% in person, 15% virtual, but it could easily, if I had to, go to virtual. But I think with your particular business, wow, your reach is expanded. So when you say that you are licensed in Washington, you said that you can still service people nationwide, right?
So yes, I do. So now to get into the legalities and all of that, since I was trained in biofeedback, and I consider myself, anybody who does mind-body practices, meditation, we think of ourselves as coaches. Even biofeedback practitioners, most of them are either PhDs or physical therapists or doctors, nurses, a lot of nurses that do biofeedback. But in the real sense of biofeedback, we're just training the person to become more aware of how their body's working, even though insurance will say, oh, is it helping with migraines? But you learn to regulate your blood pressure and your body temperature, it's going to have an impact. It doesn't work for everyone. But so we think of ourselves as coaches. So the way I work with people who are out of state, if their insurance will cover me, I can give them an invoice, but I'm a cash practice. I give people invoices super bills with codes, if that's what they need. But most of the time I'm saying I'm working as a coach. I'm working as a trainer. I'm working on helping you learn to regulate your nervous system. Yes, PTSD, anxiety,
Yeah.
hypertension brought you in, but we're not really doing that. We're working on how you're showing up and engaging with your life. And it can have lasting impacts on a number of conditions. As we
Yes.
know, stress
Yeah.
kills. That's people
Yes,
say
it
that
does.
simplistically. Overwork.
And it exacerbates a lot of other disease processes, right? So
Right.
is it kind of like, helping someone find what those triggers are and then
Yes.
helping them work through that by, listening to their body, because our body tells us things when we really need somebody like you to help us hone in on that. Why is it when certain conversations come up, I all of a sudden start sweating? Or, or why is it when certain conversations come up or certain people come around?
Oh, I've said that before. Yeah, so-and-so walks into the room, or your boss walks by, or you even think about your boss and your body starts to respond. So that is my work. The very first session with anybody, no matter what approach they're looking at, if they want to learn breath work or to regulate their heart rate or whatever, the very first session is about identifying your triggers, and of equal importance is your stress responses. What are your
Yes.
particular
Okay.
responses to triggers? And then the third piece is, that's great to know. That's what disease model of healthcare is. Let's look at the pathology. But then we spend equal amount of time going, how do you want to be? So, I'm pointing up to the sky, like, what's your North Star? So it's like, it's great to say, oh, I want to let it go. But how would you like to be when your boss walks into the room and says, maybe in a calm voice, did you get it done? And you're vomiting, you're already, and that takes practice because we've been conditioned to respond to triggers a certain way. But that doesn't mean it's set in stone. We can learn to, it's just like being right-handed. If you have a left hand and it works, you could learn to be left-handed, but you're going to have to practice it over and over again.
Right.
So we're not only dealing with the triggers and the stressors, we're dealing with, okay, let's say, how do you practice breathing, softening your muscles? Now, if you're not safe though, if your boss walks in and he's physically abusive, then we have a different conversation of like, well, it's not as simple as, it's not as simple as saying, quit your job. That's what a lot of people will say. Yeah, I'm going to be homeless. That's fine.
And I think lots of times people say things just to be saying them because they don't know what else to say. You know what I mean? Like when someone is grieving or someone's going through a divorce or someone has lost someone, the other person, they feel like they got to say something, but sometimes those are triggers.
Yes.
For the person that's going through it, and everybody's not the same. Everybody can't just say, oh, shake it off, So, you know what I mean? So being able to have someone like you to be able to say, everybody's an individual, everybody's different. And everybody doesn't respond the same. You can't put everybody in a box.
No, we want to. I mean, I even noticed at the times I want to do that. And it's and we all put ourselves in a box.
Yeah.
I should be able to do this. I shouldn't let that affect me. And that I think is more damaging than what other people will say at times.
I think that causes more stress on you because you're beating yourself up saying, oh, well, I should not feel like this and I can't help it, but I should be able to get through this because everybody keeps telling me that I should be here now and I'm still back here. So there's so many traumas I can think of that you help people. Oh my gosh.
Yeah. And that's the second thing I say. First, we identify triggers and trauma, but I say to people the first practice, other than awareness, because that's the first, the second practice I should say is compassion. Every single thing we're going to do is going to be talking about compassion. It doesn't give you a free pass to behave however you want, but it does say, hey, I'm responding this way. I've been conditioned to react that way. Give myself some break.
Right.
Almost
Right.
everyone I know who is so hard on themselves, almost every patient will tell me, I would never say this to my friend. I would never say this to my sibling. Well, they might say it to their sibling, but they would never say some of the things they say to themselves to other
Mm-hmm.
people.
Mm-hmm. Yeah, because we're harder on ourselves usually than we are on other people, right?
Yeah.
So, oh my goodness. So, wow. So, I heard you say that insurance pays for your service. Do you have any private pay or
No, I'm
how does
all,
that?
no. So
All
I
cash.
I don't
Oh,
take insurance
okay.
myself.
Okay.
What
Okay.
I do is I give people invoices, super bills, if they're going to bill insurance.
Okay.
Um, I've always, since I was doing HIV care, I didn't take insurance back then. And I would say to people, if you can pay the full price, that's allowing me to see other people. I do sliding scale still.
Okay. Good.
Because, I
Yeah.
think it's necessary.
Yeah. Yeah. I mean, being flexible, so sliding scale or paying full, either way, you're willing to work with the clients as individuals,
Yes.
so that's what it's all about. Because we could get in insurance, but I'm going to not.
Thank you.
That's, you know how I feel about it.
Yeah. Yeah,
Like,
we can.
uh-huh.
Yeah,
But we're going to
exactly.
keep it with Dr. Brad.
Thank you. Yeah.
Yes. So if someone is suffering from some type of post-traumatic stress disorder, or maybe they are a victim of abuse, would that be your ideal, typical clients?
Yeah. Yes. Yeah.
Yeah.
I do work with a lot of people who have PTSD diagnosed, not just
Mm,
from me, from other people.
right.
Uh, and we use the word trauma so much in our culture right now. And
Mhm.
then we get into the suffering Olympics, I call it. It's like, no, well, my trauma is worse than your trauma. And
Mhm.
I can't remember which person I heard, some author who said, just trauma is anything that disrupts your self-regulatory capacity.
Right.
And so we can't claim to know what another person's trauma is. And usually when we say, oh, that triggered me, there's a lifetime back of other things that condition you to respond that way. So
Mhm. Mhm.
yes, that's the client I work with, no matter what their diagnosis is. The most
Right.
common one are PTSD, chronic anxiety,
Mhm.
and then often terminal diagnoses or life-threatening diagnoses that they're just looking to explore how to navigate. Those are the top.
Yeah. Yeah, because it could be a plethora of things, right? Because, as I think, even caregivers, when I'm talking about caregivers, I'm not talking about healthcare professionals. I'm talking about what we call the sandwich generation. When you are trying to juggle life and you are trying to navigate this complex healthcare system, sometimes I suffer from trauma with that.
Oh my God.
It's
Yeah.
like, oh, and you can help someone like that as well, right? Just kind of help them, how do you handle the things that are going to be thrown at you, because the healthcare system is not fair, not compassionate, not understanding. It's all about what's easier for the healthcare professional sitting on the other side of the desk. I'm just keeping it real.
Well, and I can say that,
It's just like,
I agree. I mean, when my father died of
mhm,
stage 4 lung cancer, and I, having worked in hospice and cancer, I talked to his medical doctor, his oncologist, about why was he still doing this experimental treatment when I knew it was causing all his side effects, because they listed them. And he's like, well, we got to do something for him. I'm like, not give him more side effects. And then when I watched when my mother died, last year in January. And the facility she was, it was in the middle of the lockdown, right? My sister lived just a few blocks away, but couldn't get there. And I know they were understaffed and they made mistakes in her care. And it's that example. It's like, how do you sit with, there was nothing else we could do. You know, if I had $1 million, it would have been much easier. Maybe not 1 million anymore, 2 billion, you know, whatever. But if I had it, I could do that, but I couldn't. How do you sit with that? Like, if they did things differently, if the system supported people, if the systems in place supported people, we wouldn't have, I can't say half, we wouldn't have had a lot of the trauma that we have.
Right.
So
true.
yes, I work with people who are dealing with taking care of their family. And again, there's a lot of guilt there. Because they think they should be able to do things when the system's broken.
Yes. Wow. Man, oh, this is awesome, because my mind is just like floating with all the people that you are able to help and have helped. Just like amazing to know that there's a service out here that's like this. So if someone, I mean, if someone wanted to, consider reaching out to you, or, just had some questions and wanted to find out more about your other services and things that you do and how could they on board and different things like that, what is the best way that they could reach out to you? Is it email, or is it a plethora of things? I like that word.
Well, they could go to my website. That's where I would direct them first. The website is thebreathspace.com. And I offer everyone who wants to work with me a free 20-minute consultation, because I believe if you're going to do this work, you have to determine if I'm the appropriate person for you, not if you're a good fit for me. Are we a good fit together? Because we're working on this together. And so that 20-minute free visit, so they can interview me, ask me any questions. I've had some people who go, oh, I'm not ready for this. I had one gentleman say that, and 5 years later, he came back. Other people go, oh no, do you have any other resources? Like, oh yeah, let me refer you somewhere else if I have them. And then, so you can book a 20-minute consult. You can book any of the appointments on my website, on my services. There's a private sessions page, and you can book that. I also offer, by the way, free guided meditations twice a week on Mondays Pacific time at 7:30 to 8:30. I do a live stream meditation.
AM and then or PM?
AM.
Okay.
So that would be, depending on where you are, it's Pacific time. And then on Thursdays, it's at 8 to 8:30. And I also do it on Clubhouse. So yeah, I have to add the Clubhouse things to it, but yeah, I do that on Clubhouse. So there's other places, and I have also a resource page on my website of all my guided meditations, not all of them, but a lot of my guided meditations. So there's those options too. So that would be the best way to reach me, is through my website. You can also just email me through my website as well.
Okay, one more thing before I let you go. So do you do group sessions, or is it all individual?
Both.
Okay.
Both. Yeah, I've done group classes. I've had families who've come together. I've also done a lot of webinars for different organizations. So if people are interested in, like, I have a group of people and we want to do, learn some of this stuff, I'm more than happy to do that as well. Wow.
Well, this is awesome. So repeat that website one more time for the audience.
TheBreathSPACE.com. TheBreathSPACE.com. Yes.
Awesome. Thank you so much, Dr. Brad, for taking your time to come and chat with me and educate me and the audience. And I want to thank the audience for tuning in to Health Chats Among Friends, where we bring you reputable resources from our local communities. Tune in next week for another amazing guest and another amazing resource. Thank you again, Dr. Brad.
And thank you for doing this. Thank you for being a resource to everyone.
Oh, no problem. I love it.